So when it comes to talking to your child about safer sex or safe sex, the safest sex of all, obviously, is not having sex at all. Abstinence is really the way that you're going to avoid all infections. However, that may not always be realistic because your child or adolescent may already be experimenting or exploring the sexual realm. So when it comes to that, then it really is important to stress the usage of condoms. It's really the best thing we have in terms of protecting against infections of a sexual nature is to consistently and accurately use condoms every time with every act of coitus. If you're not comfortable really talking about that with your child, their doctor should be comfortable, and so I would definitely have them address that with your son or daughter the next time they go in for a physical exam, or if you want to bring them in specifically to talk about that issue. And for instance, myself, I'm comfortable even demonstrating on a model that we have in the office of how to correctly place a condom so that young people can practice and can feel comfortable, and it's not something to joke around about, that it is a very serious issue and has very important medical consequences. So you should talk to your sons as well as your daughters about birth control methods, because even though your son obviously cannot become pregnant, unless you want to become a grandmother at this point in time, and your son may be held accountable both financially, emotionally, as well as physically for helping to raise that child, then I think it's important also to discuss with your son current methods of birth control and why their girlfriend should probably be using them.